My name is Kaya Dillon,
My name is Diego Garcia.
and today we'll be presenting a presentation on the theorist Sister Calista Roy and the Roy's adaptation model.
So, some quick background about Sister Calista Roy. She was born on October 14th, 1939. She is a nun, nursing theorist, professor, and author. Um, she was a professor and nursing theorist at the Boston College Cornell School of Nursing, and in 1991 she founded the Boston-based Adaptation Research in Nursing Society. The abbreviation is as follows, and she would later rename that to the Roy Adaptation Association. And to get in more specifically about her, I don't know how to say this, nunship, I suppose, or her credentials. She belonged to the Sisters of Saint Joseph of Carondelet, I believe is how you would say that. The abbreviations are as follow. There we go. And how her background correlates to the adaptation model that she later developed. Some key components that I found would be her religious background, which had a huge influence on her holistic take on nursing and her thoughts on the healing process of patients as a whole. Her extensive work and education in the field of nursing definitely helped her conceptualize and practice her model. And this happened well before it was published. Actually, um, if I'm correct me if I'm wrong, but she practiced her model in 1963 or 64 when she was in grad school. Um, and that's where the idea came from, and she started practicing it in her work. And as you can imagine, her education helped her develop it further. Um, Furthermore, her continuous research and work has led to the adaptation model undergoing various changes throughout the years. And this is not only through her own work, but the work of others and the collaboration of many. Some of the ways in which it has changed has been a greater understanding of spirituality and its effect on adaptation. Another would be cultural sensitivity. And lastly, the use of current measurement tools. And here's an example, the Coping and Adaptation Processing Scale, otherwise known as CAPS. The implementation of new and developing uh, concepts is good for this model because it is really patient centered, and nothing. The best way to treat a patient is to understand everything as much as you can about them. So, implementing new and developing strategies to the adaptation model is definitely great.
So the point of the Roy adaptation model is to represent how people will respond and adapt to their internal and external environments. And it's good for nurses to know that because if we know that we can help promote successful patient-centered care, adaptation, and proper healing, because if they have adapt, if they're settled, then they can heal better. So the adaptation model, it creates three levels of adaptation or life processes. They are the integrated level, the compensatory level, and the compromise level. The process of coping and adapting is divided into two groups. We have the regular cognitive subsystem and the stabilizer innovator subsystem. They are used to maintain the integrated life process, which is like the stable part of it, where everything gets working together correctly to keep the patient stable. These adaptations, they are manifested in the form of behaviors. They are seen in four categories. They are the physiological physical mode, self-concept group identity mode, role function mode, and the interdependence mode. And the model also uses three classes of stimuli to form the environment, and they are the focal stimulus, contextual stimuli, and residual stimuli. And as we continue on with our presentation, I will dive deeper into those. And this is like a general idea of how everything is layered out and how um, Sister Roy organized it all, her entire theory and model. Okay, So the first thing we're going to talk about is the levels of adaptation or the life processes. So like I said, the integrated level of adaptation, it is all about maintaining stability. Everything in the environment, their patients' coping mechanisms, the behaviors, structures, functions of life, they all come together to properly meet the patient's needs. We go to the compensatory level of adaptation. That is when the integrated level hasn't has is being challenged by something. So we go to the compensatory level so that we can try and maintain that stability which has been thrown off track. And if the compensatory level doesn't work, then we're in the compromise level of adaptation. So that's when the compensatory level has failed to reestablish adaptation. As a result, the person has to start all the way over to gain some sort of stability.
Next, we have the cognator and regulator subsystems, and some key components of each would be as for the cognator system, would be these four channels. The first one being perceptual and information processing, the second being learning, the third being judgment, and the fourth being emotion. These are all very important concepts to this subsystem, and they go a long way in patient care. Uh, as for the regulator subsystem, it would involve coping processes, and these are more physical than conceptual. So first would be the neural systems, second endocrine systems, and third chemical systems. These are, of course, within the body. All right, and this is the stabilizer innovator subsystems. And some key concepts to understand is that stabilizer would be pertaining to maintaining stability involving organizational structure, cultural values, and daily activities, and accomplishing the goal of a social system. All this is what we would kind of define as stabilization in our lives, maintaining these organization of certain concepts. Uh, for the innovator portion, it would be creativity, change, and growth. Innovation, as you can imagine, can be easily defined as these three words: creativity, change, and growth. Um, and that is, of course, what we want to produce through the Roy adaptation model is these concepts.
Now we're going to talk about the four behaviors in the award adaptation model. We have the physical mode. So it refers to an individual or group's chemical reactions in their body and the basic human needs such as nutrition, elimination, oxygenation, rest, and protection. Then we move on to the self-concept group identity mode. It refers to the individual's body image, how they feel about themselves, as well as to how they feel when they're within a group or when they're referring to their interpersonal relationships. It just refers to that person in context of themselves and around others. Then we have the role function mode. That is just the primary, secondary, and tertiary roles that a person occupies within a society or a group. And then the interdependence mode, which is related to the person's relationships and with others and giving and the receiving of love. This is properly obtained through communication and learning that person's love language. Next, we're going to talk about stimuli. So there are three types of environmental stimuli. We have the focal stimuli. It is the immediate internal or external factors introduced to a person. So let's say if you're pregnant, then during that first trimester, you're going to be nauseated, you're going to be vomiting. Or if you have experienced some type of injury, you're experiencing pain. And that is the pain, the nausea, the vomiting, that is the focal stimuli. The contextual stimuli is the factors that influence a person's response to the focal stimuli. So, what's causing the vomiting? Well, it's the pregnancy. And what's causing the pain? The car accident that caused the person to be in pain. And the residual stimuli is the factors that affect the situation. And it is based on a person's reaction to the altered environment. So you've been through a car wreck, you're in lots of pain, and now you've been delivered to the hospital. And the hospital is the residual stimuli. Now you have a lot of anxiety because you don't know what's all going to happen or what's going on, and that is how you're choosing to respond to it.
These are this is how the philosophy of the Roy adaptation model relates to both our personal philosophies. And so some of the key touching points I want to talk about are first of all, patient centered care. We both believe that the patient, of course, comes first, and that what we do as nurses should be totally involving and centered around that one patient, you know?
And then in terms of improving quality of life, well, it's always when you're a nurse, the priority is the patient. We want to make sure the patient leaves better than how they came in. And with the adaptation model, that allows you to learn everything you need to know about the patient to figure out how people adapt to the changes they're going through, the injuries they're experiencing, the stuff they're dealing with while being in the hospital. And when we learn those, we can implement steps to make sure the patient is okay, and that improves their quality of life.
Another one is identifying patients as more than their illness. It is easily to get caught up in just thinking that the patient is just, just words on a chart, right? We need to understand that what they're experiencing goes far beyond just what you see in the hospital. They're having there's impacts on their social life. Their mental well-being, and the Roy adaptation model takes all that into consideration. And I believe that it really aligns with our personal philosophies as far as knowing that the patient is so much more than just another person, just another person in general. Like, they're here, they need your care, and the stuff you need to do for them stretches far beyond just treating them. We need to think about other ways to help them through everything that they're going through, besides just this one thing that they're in the hospital for.
And then, in terms of understanding the dynamic concepts, principles, and stimuli associated with nursing, this relates to our philosophy because it is very important that we understand this and that we apply it. Because, like I said, patient centered care, making sure the person's quality of life is improved, is very important because this is a person, they have family, they have friends that care about them, and it's our job to make sure that they get better. So the adaptation process from Roy, it involves all of those qualities, all of those important things that we as nurses future nurses need to know in order to provide proper patient care.
And the maintenance of physiological, psychological, and social integrity is also very important for the patient because, as I just mentioned, they're going through way more things than what they're just in the hospital for. It impacts every single aspect of their lives. So, seeing that included in the Roy's adaptation model, upholding those values and principles for them is definitely aligns with our values and what we believe the patient should experience when they're under our care. And there's nothing about Roy's adaptation model that doesn't align with our philosophy.
Yes, we completely agree with it, and we want to use that during our process of becoming good and proper nurses.
So here's a clinical application of Roy's adaptation model. So imagine you're caring for a patient with diabetes, right? So using Roy's adaptation model, you're going to be able to enhance the experience of the patient you're caring for and provide higher quality care as well as like personal care to facilitate all their needs. So starting at the application, we want to make sure that you're using a holistic approach to nursing. And basically, you just want to be able to understand that the patient's illness is affecting many different aspects of their life, and it's not just simply a medical diagnosis. And that's just reiterating what I've been saying over and over about how the patient experiencing way more things than just what they're in the hospital for. As with this patient with diabetes, they may have just had their foot amputated. So let's take that for an example. Their whole life's going to change now. They're probably feeling really self conscious about it. Um, you can do everything you can to treat their foot, but is that going to help them feel better, like emotionally? Probably not. Um, so the next thing you want to do, otherwise, like the first thing you want to do is identify the patient's stimuli. So using that amputated foot as an example again, that would be a stimuli. And then, like I said, the self body images, that would be a stimuli, of course. So those are some little examples. So after you are done assessing the stimuli, the response to those stimuli, you will need to formulate interventions based on the four modes of Roy's adaptation model, which are as follow: physiological, self concept, role function, and interdependence. And by formulating these interventions around these four modes, you're going to be able to tackle a wide variety of their problems and hopefully provide a great deal of assistance and care to their life as a whole. Because using these modes, you're going to be able to tackle many different problems, such as like their emotional state, their physical state, you know, a wide variety, more than just treating their wounds and caring for them.
So in the physiological mode, we're going to educate the patient about diabetes management. So this is a new thing for the patient. They just got diagnosed with diabetes, and we want to make sure they leave with all the proper tools to make sure they stay healthy outside of the hospital, outside of our care. So we're going to talk about their diet, their needs in terms of their diet, their medication, and the importance of exercise. Then we're going to move on to the self concept mode. We're going to address the patient's feelings of self worth and any body image issues. Now, like I said, this is a new thing for the patient. They just got diagnosed with diabetes. They're feeling their way, and it may even show that they have diabetes. Like you said, the amputated leg. It may show, and they may feel a bit self conscious. Like this is a new thing they got to get used to. So we need to provide them with all the necessary support, such as support groups and individual counseling. Next, we're going to go into role function. So we're going to help the patient adapt to their desired role and function in life and society. So the patient, they just got diagnosed with this, and they're wondering, well, how is this going to affect my job? How's this going to affect my home life? How's it going to affect my parenting? Where we're going to address all of that and help the patient adapt to their new roles and answer any questions they may have about how it may directly affect it. Then we're going to dive into the interdependence mode, which establishes co responsibility for goal achievement. In this stage, we use whatever the patient's feeling and then combine it with things I can do to help, and then their desired goals and the things I feel like is a necessary goal, and we share those missions and those values. We combine them and make a goal that works best for the patient and to make sure they are successful outside of my care. And that is pretty much it for the explanation of Roy's adaptation model. And thank you all so much for watching. And yeah, see you later.
Bye bye. Ready.
Hey, Diego.
It's off mute. It's recording. We're okay this time. All right. Just make sure. All right.